How long has it been since you allowed yourself a piece of chocolate without feeling like you were hurting your kidneys? If you've been living with chronic kidney disease, diabetic nephropathy, or kidney-damaging blood sugar levels, I'd guess it's been years. And I want to tell you something today that may genuinely change how you look at your condition, and how much fear you carry into your kitchen every single day. The advice you were given, that chocolate is the enemy of your kidneys, is not just outdated. In some cases, it has cost you a tool that could have been quietly working in your favor all along. There is a form of chocolate on your grocery store shelf with a glycemic index of just 22. Less than 1/3 of white bread. It contains compounds documented in peer-reviewed clinical studies to improve insulin sensitivity, lower the inflammatory markers that drive kidney damage forward, and reduce the oxidative stress that is one of the leading causes of declining kidney function. The difference between this chocolate and the one harming you is sitting on every label, waiting 30 seconds for you to read it. I need you to understand something before we go any further. Your kidneys are not passive bystanders in blood sugar disease. Every single time glucose spikes in your bloodstream, your kidneys are the ones forced to work overtime to filter it out. Sustained high blood sugar doesn't just damage the pancreas. It scars the tiny blood vessels inside your kidneys, the ones responsible for filtering your blood, and that scarring, once it begins, does not easily reverse. High blood sugar is one of the single greatest threats to kidney survival. Which means anything that helps stabilize blood glucose is not just protecting your heart or your nerves. It is protecting your kidneys directly. Today, I'm going to walk you through 5 specific types of chocolate that the evidence supports for people managing blood sugar and kidney health. Pay close attention to number 5. It is the cheapest option of the 5, and it carries the strongest clinical evidence of all. Before I begin, if you're interested in this topic, type interested in the comments and don't forget to subscribe. The goal is to hit 200,000 subscribers, and every single person who joins moves us closer. If you want my free kidney warning signs checklist, type the words kidney checklist in the comments right now and I will send you the download link personally. Completely free. Just 2 words, kidney checklist. Drop it below and let us get started. Now, before I name a single one of those 5 types, I have to give you something that almost no article about chocolate and kidney health ever explains. Because if you don't understand this part, the 5 types I'm about to share will feel like a random list. Once you understand it, every single one will make complete biochemical sense. Here is the truth most people miss. The benefit is not in chocolate. The benefit is in cacao. Those are 2 entirely different things. A mass-produced milk chocolate bar packed with sugar, hydrogenated vegetable oil, and barely any real cacao has almost nothing in common with the cacao bean itself, except a vague flavor. The healing compounds live in the cacao. The industrial bar simply borrows its name. Cacao contains a concentrated group of plant compounds called flavonoids. And the 2 that matter most for your blood sugar, and therefore your kidneys, are catechin and epicatechin. These have 3 mechanisms that work directly on the disease you and I are trying to manage. The first is improving insulin sensitivity by repairing the lining of your blood vessels. Picture insulin resistance like a phone line full of static. Insulin is calling. Glucose is waiting at your cells, ready to come inside. But the cell can't hear the signal anymore. Cacao flavonoids work on that lining, the endothelium, and they help clear the static so your cells can finally receive the message. Fewer glucose spikes means less filtration burden on your kidneys with every single meal. The second is reducing oxidative stress. Cacao sits among the highest-ranking foods ever measured for antioxidant capacity. And oxidative stress is not some abstract concept, it is one of the central drivers of kidney cell damage. Bring oxidative stress down, and those kidney cells face less destruction with every passing day. The third mechanism is the one that genuinely changed how I think about this food. Epicatechin, the most abundant flavonoid in cacao, has been shown in cellular studies to stimulate insulin secretion and support the regeneration of the beta cells in your pancreas, the cells that actually produce insulin. In blood sugar disease, those cells slowly get worn down. The idea that a food compound could help restore that function, rather than just compensate for losing it, is a fundamentally different conversation. And every increment of improved insulin function is one fewer wave of high glucose battering your kidneys. So when I rank these next 5 types, I'm not picking favorites. I'm ranking them by how much flavonoid they deliver and how strong the clinical evidence is behind each one. Number 1, dark chocolate with at least 70% cacao. I put this first not because it's the most powerful, but because it's the most realistic place to begin. The flavor is firm but still enjoyable. You can find it in any grocery store. And the science behind it is solid enough that I have no hesitation recommending it. Here are the numbers. 70% dark chocolate has a glycemic index of around 22. Table sugar sits at 65. White bread is around 71. A square of good dark chocolate produces a slow, gentle rise in blood sugar. Not the sharp spike that triggers a flood of glucose your kidneys must scramble to process. The reason is simple. At 70% cacao, there is far less sugar in the bar. And what remains is balanced by cacao fat and cacao fiber. Both slow digestion. The fiber delays how quickly your stomach empties. The fat slows how fast any sugar reaches the absorptive surface of your small intestine. Your kidneys simply never see that sudden flood. Let me tell you about Sandra. She came to my office at 61 with stage 2 chronic kidney disease and an eGFR of 58, already in a range that required careful monitoring. Her nephrologist had told her to watch her blood sugar closely. She had been eating 4 or 5 pieces of milk chocolate every night for years and felt tremendous guilt every time. I didn't tell her to stop chocolate. I told her to switch. 2 squares of 70% dark chocolate eaten after a dinner with protein and fiber. 3 months later, her fasting glucose had improved meaningfully, and at her next nephrology appointment, her eGFR had held steady at 59 rather than continuing its prior decline. The part that moved her most, she said, was that she finally felt like she was doing something kind for herself rather than just restricting everything she loved. A clinically supported portion is 20 to 30 grams per day, 2 or 3 small squares. Research published in the American Journal of Clinical Nutrition has found that regular cacao consumption is linked to reduced cardiovascular risk, which matters enormously for kidney patients because cardiovascular disease and kidney disease accelerate each other in a dangerous cycle. Now, here is the label trap. Many bars sold as 70% dark chocolate actually list sugar as the first ingredient on the back. The front of the package is marketing. The ingredient list is the truth. Flip the bar over. Cacao mass or cacao paste must be the first word on that list. If sugar comes first, the bar is not what the front claims, no matter how dark it looks. Number 2. Dark chocolate with 85% cacao or higher. At first glance this looks like a stronger version of number 1. It is not. The clinical evidence behind 85% and above is a different conversation entirely. As cacao percentage climbs, 2 things happen simultaneously. The flavonoid concentration rises substantially, and the sugar content drops from around 20 to 25 grams per 100 grams down to roughly 10 to 14. You are getting more of the protective compound and less of the harmful one in the very same bite. Here is the study I want every kidney patient to know about. A clinical trial examined chocolate with 83% cacao in 60 patients with type 2 diabetes and high blood pressure, ages 35 to 70. Each person consumed 25 grams a day containing 450 milligrams of flavonoids for 8 weeks. The results were striking. Lipid profiles improved, and 3 of the most critical inflammatory markers, CRP, interleukin-6, and TNF-alpha, dropped significantly. I want you to understand why this matters for your kidneys specifically. These 3 markers are not just numbers on a report. They are the 3 lieutenants of chronic low-grade inflammation. And chronic inflammation is the silent fire that keeps both insulin resistance and kidney damage burning forward year after year. Inflamed kidney tissue scars more easily. Scarred kidney tissue filters less effectively. When you lower CRP, you are not just managing a statistic, you are turning down the heat on the very fire that is slowly destroying your filtration capacity. There is more. Two large Swedish studies found that increasing dark chocolate consumption to at least 50 grams per week reduced stroke risk by up to 27%. For a kidney patient whose cardiovascular risk is already significantly elevated, that is not a footnote. That is direct protection of the brain and vascular system that your kidneys depend on to function. Before I go on, what was your most recent eGFR reading? And has any doctor ever sat you down and explained how chronic inflammation is driving your kidney decline forward, year after year, even when your diet seems reasonable? Tell me in the comments. A practical portion here is 20 to 25 grams per day. One quiet advantage of 85% chocolate is that the flavor is so intense and so much less sweet that you naturally stop after 1 or 2 squares. Patients who could never moderate milk chocolate find moderation effortless at 85%. That consistency, repeated day after day, is what moves health markers over months. Number 3, 100% cacao and cacao nibs. No added sugar. No added milk. No added fat beyond what already lives inside the cacao bean itself. This is cacao stripped to its truest form, and from a blood sugar standpoint, and therefore a kidney standpoint, it is as safe as solid chocolate ever gets. Cacao nibs deserve special mention. These are simply pieces of roasted cacao bean, crushed but not refined. Because they skip the pressing and conching steps that other chocolate goes through, they hold more flavonoids and more fiber than any processed bar. They are crunchy, deeply bitter, and look almost nothing like the chocolate you grew up with. Let me be direct with you the way I would in my office. Most patients cannot eat 100% chocolate as a treat. The bitterness is too sharp for a palate that has known sweetness for 60 or 70 years. I have no interest in pretending otherwise. So I don't recommend it as a snack. I recommend it as an ingredient, and that is where it becomes both powerful and pleasant. A teaspoon of cacao nibs across plain Greek yogurt. 10 grams of 100% chocolate melted into a spoonful of almond butter. A small handful of nibs folded into your morning oatmeal. These are simple shifts, but they deliver real flavonoid content without meaningfully moving your blood sugar curve, or burdening your kidneys with a glucose surge to process. Let me tell you about Thomas. He came to me at 69 with 11 years of type 2 diabetes and an eGFR that had slipped from 62 to 54 over 3 years, a trajectory that worried both of us. He had given up chocolate entirely for 4 years. His numbers had not improved. We talked about cacao nibs, and he started adding a teaspoon to his morning oatmeal every day. 4 months later, his fasting blood glucose had dropped noticeably. His nephrologist noted reduced protein in his urine. An early sign that filtration stress was decreasing, and Thomas looked at me across the desk and said something I still remember: "I can't believe something this good is actually helping me." Number 4, sugar-free chocolate sweetened with erythritol or stevia. I am going to be direct here, because this is where the food industry plays its most dishonest game with people managing blood sugar and kidney disease. First, the science of what actually works. Erythritol is a sugar alcohol with a glycemic index of essentially 0. It carries about 70% of the sweetness of regular sugar, but your body processes it through a different pathway and excretes most of it without significantly raising blood glucose or stimulating insulin. Stevia, derived from plant leaves, takes a different route to the same destination. The active compounds are not metabolized by your body at all and produce no measurable glucose response. A chocolate bar sweetened with erythritol or stevia gives you a flavor surprisingly close to the milk chocolate you remember, with almost none of the metabolic cost, and none of the glucose surge that your kidneys would otherwise be forced to filter. But here is where you must be careful. Many bars marketed as sugar-free in the United States, Canada, and the UK do not use erythritol or stevia. They use maltitol. And maltitol has a glycemic index of 52. That is not low. That is genuinely capable of raising your blood sugar, and therefore triggering the exact kidney filtration burden you are trying to avoid. On top of that, maltitol in older bodies frequently causes uncomfortable bloating, gas, and even sudden diarrhea, because it draws water into the intestine. Here is your 30-second rule for this category. Pick up the bar, flip it over, look at the sweetener line in the ingredient list. You want to see the words erythritol or steviol glycosides clearly named. If you see maltitol, isomalt, or a vague phrase like sugar alcohols, without specifying which one, put the bar back on the shelf. A label that reads, diabetic friendly, in large letters can be hiding an ingredient that does the exact opposite of what that promise suggests. Trust the back of the package. Never the front. For your kidneys, this 30 seconds of reading is not optional. Number 5. Pure unsweetened cacao powder. This is the one I told you to pay close attention to at the start. It is the cheapest thing on the shelf. You can buy a large container for the price of a single fancy chocolate bar. And it is the form of cacao with the strongest clinical evidence behind it, by a meaningful margin. Let me walk you through the study that changed how I approach this with my own patients. A systematic review conducted by researchers at the Universidade Federal Fluminense in Brazil, published in 2021, analyzed 7 clinical studies examining the effects of cacao flavonoids on blood glucose and serum insulin in people living with type 2 diabetes. The consolidated finding was this. Dark chocolate or cacao powder at a dose of 25 to 30 grams per day showed beneficial effects on blood glucose and on hemoglobin A1c, along with cardiovascular protection through improved HDL cholesterol. I need you to understand what the A1c finding means for your kidneys. A1c is the gold standard. It tells your doctor how well your blood sugar has been controlled over the past 3 months. It is not a snapshot, it is a season. And one of the most reliable predictors of how quickly kidney function declines in people with blood sugar disease is long-term glucose control. When a dietary intervention moves A1c, you are not seeing a fleeting effect. You are seeing a structural change in how your body is handling glucose, and every improvement in that number is a reduction in the daily filtration burden being placed on your kidneys. Why does pure cacao powder outperform even the best dark chocolate bar? Because manufacturing a bar requires pressing, conching, and tempering, and every one of those steps degrades a portion of the flavonoid content. Pure natural cacao powder, the kind that has not been alkalized or Dutch processed, skips most of that loss. Think of a chocolate bar like tea brewed from a bag that has already been steeped twice. There is still flavor, but the active compounds have faded. Pure cacao powder is the whole leaf. In practice, this is the easiest of the 5 to build into your daily life. A tablespoon stirred into black coffee. A spoonful blended into plain full-fat yogurt. A teaspoon warmed gently with unsweetened almond milk on the stove. A small amount folded into morning oatmeal. Every one of those choices delivers more flavonoids than a square of dark chocolate, with essentially no impact on your blood sugar curve and no additional work for your kidneys. Let me tell you about Patricia. She came to me at 66, 5 years into type 2 diabetes, with an EGFR that had been parked at 52 for 2 years. She was on her medication faithfully, walking every day, watching her protein intake carefully as her nephrologist had instructed. She told me, almost in tears, I feel like I'm doing everything right and my kidneys are still losing ground. I changed exactly one thing. The sugar and creamer in her morning coffee became 1 tablespoon of pure cacao powder, a few drops of stevia, and unsweetened almond milk. 6 months later, her A1c had dropped from 7.1 to 6.5, and her EGFR, for the first time in years, had actually risen by 4 points. This is not magic. This is biochemistry, working quietly every morning in a single cup of coffee. The label trap here is the simplest of all. The ingredient list should contain exactly one item: cocoa powder or cacao powder. Nothing else. Avoid hot chocolate mixes, drinking chocolate blends, and any flavored cocoa product no matter what the front claims. Even the ones labeled reduced sugar or diet will quietly contain added sweeteners, modified starches, or oils that destroy the metabolic profile you just learned about, and some of those additives carry a phosphorus or potassium load that kidney patients in particular need to avoid. Before I close, I want to address something that almost never gets discussed in a clinical conversation about food and kidney disease. And I think it may be the most important thing I say today. Have you ever forbidden yourself a food completely, only to find yourself eating twice as much of it on a weekend, and then spending the next week silently punishing yourself for it? If you nodded just now, please understand, you are not weak. You are human. And your body is responding exactly the way the research predicts. Studies in nutritional psychology have found that people who feel guilty after eating tend to eat more in the hours that follow, not less. The guilt triggers a cycle of restriction, craving, and rebound. That cycle produces worse blood sugar control over time than a calm, planned, portion-controlled inclusion of the food you actually want. And worse blood sugar control means more damage to your kidneys. The guilt itself is costing you. Picture two patients of mine eating the exact same 2 squares of 85% dark chocolate after dinner. One of them knows the glycemic index is 22. She understands the flavonoids are quietly reducing the inflammation that was silently scarring her kidney tissue. She enjoys the chocolate, finishes it, and moves on. The other believes she is destroying her health with every bite. Her cortisol rises, her guilt rises, and by 10 p.m. she has eaten 3 more squares she never intended to touch. Same chocolate. Same body. Completely different outcome. The knowledge changed the experience, and the experience changed the behavior. This is what sustainable kidney protection actually looks like over years and decades. Not perfect restriction. Not iron willpower. Plan the inclusion, control the portion, choose the right type. Those 3 things, repeated quietly, beat a lifetime of guilt every single time. So let me bring this back to where we started. Chocolate is not forbidden to you because you have kidney disease or blood sugar problems. The wrong chocolate is. And the difference between the two is sitting on the back of every package, waiting 30 seconds for you to read it. You now know the 5 forms that the science actually supports. 70% dark chocolate. Your easiest doorway in, with a glycemic index of just 22 and a gentle footprint on your kidneys. 85% dark chocolate, where the clinical evidence shifts to reducing the inflammatory markers that keep both insulin resistance and kidney damage burning. 100% cacao and cacao nibs, the zero sugar tier, best used as an ingredient woven into yogurt or oatmeal, delivering maximum flavonoids with minimum metabolic cost. Sugar-free chocolate sweetened with erythritol or stevia. Never maltitol, which can raise blood sugar and add unexpected burden to your system. Pure unsweetened cacao powder, the cheapest option and the one with the strongest A1C and kidney protective evidence of all. Here is what I want you to do starting tonight. Open your pantry. Pull out every chocolate product you currently own. Flip each one over and read the very first word in the ingredient list. If that word is sugar, set it aside. If the word is cacao mass or cocoa mass, you can keep it. This week, pick up a container of pure unsweetened cacao powder. Make sure the ingredient list has exactly 1 item. Start with 1 tablespoon in your morning coffee or oatmeal. Check your blood sugar 2 hours after breakfast for the first few days. Your body's response is the only response that truly matters. And at your next appointment, ask your doctor a simple, direct question. Given my current kidney function and my A1C, could pure cacao have a place in my nutrition plan? That is a conversation worth having. Bring this video if it helps. Now I want to hear from you. Of these 5 types, which one surprised you the most? And which one are you going to try first this week? Tell me in the comments. I read every single one, and your answers shape what I cover next. If you know someone who has been living under the weight of chocolate guilt while quietly worrying about their kidneys, please send them this video. They deserve to know the truth. And one quiet change in their kitchen could protect their kidney function in ways their current routine is not. I want you to walk away from this video feeling equipped, not guilty. Everything I shared today is grounded in real clinical evidence and is offered purely for your education, but it does not replace the conversation you have with the doctor who knows your history, your eGFR, your potassium levels, and your full medication list. And please, never adjust or stop any medication, whether it is metformin, insulin, blood pressure management, or anything else your physician has prescribed for your kidneys, based on something you watched online, including this video. Any change to your treatment plan must go through the physician treating you. I hope this week brings you steadier blood sugar, less inflammation, and a gentler relationship with the food on your plate. If today helped you, subscribe so I can keep showing up each week with information you can actually trust and actually use. Take care of yourself. I will see you in the next one.